Well, though they can vary from person to person, most of our New Year's resolutions revolve around weight loss and getting in shape. And while this is admirable, most don't start the year thinking about our dental health and what we can do to improve our teeth. Joining me now is Dr. Esther Machin from Machin Family Dentistry and a representative of the Idaho State Dental Association to talk about New Year's dental resolutions. Dr. Machin, thanks so much for being here today.
Yeah, thanks for having me.
Of course. So let's start with this. What are some simple things people can add to their daily routines to improve their oral health?
Some of the most important things are very simple. Making sure we're brushing at least twice a day for about 2 minutes, not the quick 5-second brush. Making sure you're flossing once a day. And then stay hydrated. Moisture in your mouth really helps cut down on bacteria that sticks to your teeth, so keeping your body hydrated. Replacing your toothbrush if it's more than 3 months old, and make sure you brush your tongue when you're brushing to remove any of the bacteria harboring that can really contribute to bad breath.
Gotcha. Yeah, I think that's something that a lot of us forget to do is brush your tongue as well. So good tip there. How about this? This might seem like an obvious question, but is there anything you'd say we should cut back on to keep our mouths healthy this year?
You know, the most important thing with that is just the frequency of snacking and drinking sugary drinks. And so if we could cut back on, sodas and sugary drinks that have a lot of acid on our teeth, and then just the frequency of snacking. Every time we snack on something, we have an acid attack on our teeth. And so the frequency of how often we're eating snacks really makes a difference. Healthy snacks that people don't know actually stop cavities are eating cheese and eating nuts.
Interesting. Okay. Now, let me ask you this, and this might go hand in hand with what I just asked you, but how about bad habits? What are some of the bad habits we can get rid of that are affecting our dental health?
One of the most important ones that affect dental health is smoking. It's just really detrimental to your teeth, to your gums. It can even cause oral cancer. And so cutting out smoking and vaping is really becoming a big issue in increasing cavity rates. Grinding teeth with the increased anxiety and stress that people have felt since COVID, we've seen a drastic number of people more and more grinding their teeth. And so if you're noticing you're grinding your teeth, or if your dentist noticed that your teeth are wearing down, it'd be really important to get a mouth guard to help prevent your teeth from wearing down. Biting our nails harbor a lot of bacteria. And so as we put our nails in our mouth to bite them, we're introducing a lot of bacteria to our mouth that can make us sick.
Gotcha. Okay, all good tips there. Now, this is one that probably a lot of people may not be asking themselves, but dental insurance, it often changes when the new year comes. So how can we make sure we're getting the most from our dental benefits?
Yeah, it does change quite a bit depending on your employer. It's really knowing and understanding your plan. Look at your plan, make sure that the dentist you want to go to is in network because it really can cut down on your costs. And make sure you understand, what your copays are for your cleaning and then for more major services, just to help you have no surprises.
All right, good. Now, kind of on that exact note, how about larger investments in dental health, such as something like braces or oral surgery, something you want to know about with insurance? You have any tips on how they can check these off their lists here in 2023?
Yeah, the first step is schedule an appointment with your dentist. Talk to them about what your goals are, what issues you're experiencing, and have them work up a personalized plan that will work best for you to be able to address those issues. With any issues like crooked teeth or gum disease, cavities, the earlier you treat it, the better.
Okay, good tip there. And last thing for you, anybody that's looking for any more information on these dental topics, where can they go?
Well, we always recommend that you first start off by talking to your dentist. They know your mouth personally, and they can help you find resources that you need. If you're looking for a new dentist, you can use the Find a Dentist tool on the American Dental Association website, which is ada.org, which also has a lot of great resources.
Okay, well, wonderful. Thank you for all those tips. Joining me this morning has been Dr. Esther Machin from Machin Family Dentistry and a representative of the Idaho State Dental Association. Thank you so much for being here, Dr. Machin, and all the wonderful tips you've given us.